Greetings, I'm Dr. Kim Kyung-won. Today I'm going to talk about pathology and diagnosis of maxillary sinus lesions. As you can see, there are 8 different types of lesions. Today I'm going to talk about inflammation that is most problematic within sinus. In other words, acute and chronic sinusitis. In the next lecture, I'm going to address other diseases. I'm going to look at X-ray to go over these topics. In general, in order to diagnose the sinus lesion, X-ray is very important. I use panoramic image and cone beam CT. I'm going to talk about the usefulness and limitations of panoramic image and cone beam CT. When you first go to a ski slope, you need to determine which slope you're going to use depending on your skiing level. You need to look at the overall layout of the ski resort. Through panoramic radiography, you'll be able to get the overall picture. In doing implant treatment, you can get the big picture using panoramic image. And on the right, there's a detailed map about different slopes within the ski resort, and there are different characteristics. Depending on your skiing technique or the level of the steepness of the slope, you need to make a decision, and CBCT serves that purpose. The reason why I'm saying this is because sometimes when people ask me about surgery, they just send me CBCT without panoramic image. Panoramic image plays a very important role in giving us the big picture in providing implanted treatment and coming up with treatment plans. When you need details of that area, you need to look at cone beam CT to look at specifics. In my opinion, you need to use panoramic radiography to get a big picture in providing implanted treatment, and in order to get more accurate information, you can use cone beam CT as a secondary supplement. The main topic of today is acute and chronic sinusitis. First, acute sinusitis. This means that the symptoms of the disease continue for several days or weeks. As shown on the right, the maxillary ostium, which connects the sinus and nasal cavity, this can be blocked, leading to symptoms. The cause of this disease can be divided into different types. Nasal allergy, foreign matter. For instance, it can be caused by bone graft put in during implant surgery. Or it can be caused by septal deviation that the patient originally has. In general, it is believed that dental causes account for 10% of overall sinusitis. In diagnosing sinusitis, X-ray plays an important role, and as mentioned, you need to use panoramic radiography along with plain X-ray and CT for more accurate diagnosis. In the case of acute sinusitis, the symptoms include fever and overall weakness, headache, facial fullness, and pain in the upper posterior area. The patient can experience toothache. There can be nasal obstruction and pus-like nasal discharge as well. In general, before we provide surgical treatment in treating acute sinusitis, we need to prescribe medication. We need to include antibiotics, and if the maxillary ostium is blocked, you need to use a vasoconstrictor such as pseudoephedrine. If the patient is complaining of pain, you can provide painkillers and NSAIDs or non-steroidal anti-inflammatory drugs. However, despite the medication, if the patient continues to experience difficulty and if ostium is completely blocked, at times a surgical treatment may be necessary. Let me show you a case. This is a 52-year-old male patient. 1 week earlier, from a private dental clinic in the upper right sinus area, sinus graft was done. After 1 week, the patient complained of pain as well as nasal stuffiness, along with mild headache. That's why the patient was referred to me. At the time of initial visit, we took Waters View. In 2010, the hospital where I stayed at, there was no cone beam CT. It was not widespread. I took a plain film. If you look at Waters View in maxillary ostium, there's a little bit of haziness in the sinus, but you can see that there's airflow. I prescribed medication. I prescribed antibiotics and NSAIDs. 2 weeks later, the symptoms have disappeared, and you can see that in the Waters View, after 2 weeks, you can see compared with the right, the sinus looks much clean. In this case, technically speaking, on the left side at initial visit, if you look at panoramic image, it is difficult to diagnose acute sinusitis. Let me show you a second case. This patient was also referred to me due to acute sinusitis. After I treated the patient, I tracked the patient history, and this is the x-ray at initial visit at the private dental clinic. The patient had placed 4 implants in the upper left posterior area from canine to second molar, and sinus graft was planned for this patient. At the dental clinic, CT was taken. This is not cone beam CT because this was private dental clinic. There was no cone beam CT. This is a medical CT taken at neighboring radiology clinic. In the upper left area, you can see a little bit of mucosal thickening, and the sinus itself is quite clean. On the right side, there's significant mucosal thickening. At the private dental clinic during sinus graft, this is the panoramic image. Bone graft is placed distal to number 26. Primary stability was not good, and the dentist was not able to place the implant here. This was how surgery was done. This is after 1 month. During follow-up, the patient expressed a pain and mild headache, as well as nasal stuffiness. So the local dentist had the patient to take CT at the radiology clinic. Before surgery, the sinus was clean, but I heard during surgery there was perforation of sinus membrane. After 1 month, if you look at the CT, the bone graft is not scattered. However, the sinus, you can see that haziness has increased and there are signs of inflammation. That was how the patient was referred to me via a phone call. I received the CT image via email. If you look at the CT's coronal view in the maxillary ostium, you can see the airflow. Antibiotics was prescribed, and this is a CT taken at that time. As shown in coronal view, the maxillary ostium area, which connects with nasal cavity, you can see airflow, and the sinus graft is not dispersed within sinus, but You can see a little bit of inflammation within the sinus. Medication was prescribed 2 days later. I took the panoramic x-ray at the Chungbuk University Hospital. If you look at the panoramic x-ray, I had explained to the patient about the need to take medication. The patient received prescription from the private dental clinic and took it for 2 days. The patient told me that the symptoms have improved. I had the patient to take plain film. The patient did not take it that day. About 3 to 5 days later, this is plain film taken that day. CT was taken initially, and 5 days later, since the patient complained of sinusitis symptoms, this is the Waters view. You can see on the left side, haziness has increased, but you can see airflow with the nasal cavity. Maxillary ostium is not fully blocked. The patient was prescribed antibiotics, Augmentin, 625 milligrams for 2 weeks, 3 times a day. This is 10 days later. This is cone beam CT. You can see that compared with the CT taken from private clinic, maxillary sinus inflammation has decreased significantly. This is a panoramic x-ray at initial visit. This is 2 weeks later with medical prescription. After 1 month, almost all problems were resolved, and with just medication, the case was solved. If you look at this patient, May 2016, at the bottom is 2018, 2 years and 10 months since surgery. The graft material, due to infection, there was less bone formation. However, medication solved all issues related to acute sinusitis, and this was resolved without having to remove bone graft. Let me show you a next case. This is a third case. The patient was referred because of acute sinusitis. At initial visit, the patient's chief complaint was related to sinus graft and implant placement on both sides received in Seoul. After 2 weeks, in the upper right, implant failed, and the patient complained of oral enteral fistula. When I was looking at the patient's history, the patient was referred to me because of implant failure on the right side. However, when I looked at the patient's history, the patient also complained of dull pain and foul odor on the left side. On the panoramic image, there's increased haziness on the left sinus. The plain x-ray, Waters view was taken. If you take a look, compared with the right sinus, the left side, there's increased haziness, but you can see slight airflow in the maxillary ostium. It's similar to the first case. I decided to prescribe medication to the patient. The Augmentin was prescribed. Augmentin is beta-lactamase inhibitor and has clavulanic acid as well as amoxicillin. Antibiotics was prescribed, and at 2 weeks follow-up was done. As you can see, this is CT at initial visit. Within the sinus, there's haziness and graft material is scattered. The chief complaint was the right side. Although there was oral enteral fistula, the sinus looks more clean now, whereas on the left side it looks fully blocked. I prescribed the patient 2 weeks of medication. However, when I took a CT, the situation did not really improve. The right side, it was solved. There was oral enteral fistula, but the maxillary ostium was maintained. And with medication, although the patient took medication for 2 weeks, the patient's symptoms did not improve. Actually, it worsened. The patient continued to complain of foul odor. I talked with the ENT and planned for endoscopic sinus surgery. This is the filmed footage of endoscopic surgery at ENT. You can see pus coming out. Maxillary ostium is widened. Along with pus, bone graft material are coming out. As shown, in order to restore the maxillary sinus function, you can see that more fundamental treatment is necessary to improve the situation. This is the panoramic image at initial visit. This is 6 months after endoscopic sinus surgery. 6 months later, on the right side, the remaining implant has failed. On the left, one implant failed on the left side, but you can see that the bridge was made using the remaining implant that has survived. Even though there may not be clear difference on the plain panoramic view, if you take a look at Waters' view or take CT, you can see that there is significant difference in the condition of sinus on both sides. The reason why I'm showing you this is panoramic image is insufficient in diagnosing sinusitis. You need to look at CT to check out the difference between both sides. Axial and coronal view. If you look at before and after surgery in coronal view, the maxillary ostium has been widened and you can see sinus is functioning in a healthy state. On the left side of the sinus, the bone graft itself failed. The implant is maintained, but the graft that has been done within the sinus has failed. This was how treatment was provided. When the patient comes in complaining of acute sinusitis, you need to prescribe antibiotics first. In the two cases that I've shown you earlier, symptoms improved. At times, it doesn't. Which leads to the question, when does the symptoms improve? What kind of antibiotics should be prescribed? In my opinion, whether it improves or not depends on the patency of maxillary ostium on CT. The patency of maxillary ostium, which connects the maxillary sinus with the nasal cavity, is a very important factor. As for antibiotics, I use Augmentin most frequently. If the patient has allergy to penicillin, you can use cephalosporin or azithromycin or clindamycin. If necessary, you can do IND within oral cavity. I've talked about the radiology as well as way to treat the inflammation, and doing IND, you'll be able to learn more about it by listening in to Dr. Jung Jong-chul from Master Course. Now let's look at chronic sinusitis. This results when acute sinusitis progresses and transitions. In general, in the case of chronic sinusitis, the symptoms continue for several months to several years. In this case, at times there can be pain and headache, as well as posterior nasal drip. However, in the case of chronic sinusitis, there is no general weakness or other symptoms associated with acute sinusitis. In this case, I don't really recommend bone graft. On CT, there's overall mucosal thickening and there's blockage in maxillary ostium. In the case of this patient, the symptoms of sinusitis is not severe. However, during transitional seasons, the patient complains of a stuffy nose. The symptoms comes and goes for several months. When we talk with ENT, from ENT perspective, sinus surgery is not really imperative for this patient. However, in this case, when we do bone graft, even bigger problems can result. Infection can result. In the case of chronic sinusitis, there's radio-opaque images and mucosal hyperplasia or thickening can be observed. There can be pseudopolyps as well. This can spread to adjacent tissues. If chronic sinusitis continue to progress, anaerobic bacteria can be detected. In this case, you need to prescribe antibiotics for over 2 weeks at least. The cause of chronic sinusitis can be many. There can be chemical damage such as allergy, or in most cases, the maxillary ostium itself can be blocked naturally. At times, there can be inflammation associated with teeth such as root apex inflammation and abscess, as well as continued periodontal disease. This is a CT image of the patient that I've shown you earlier. On both sides, posterior area implants were planned. In this case, the symptom itself is not very severe, and the symptoms continue intermittently. There's nasal stuffiness as well as mild headache. This has continued for several months. At times, the patient experiences posterior nasal drip as well as rhinitis. When you look at CT in plain film, from water's view, it's not really acute sinusitis. On CT, there's overall mucosal thickening, and both sides of maxillary ostium are blocked. In the case of these patients, even as prescribe a medication, the ostium is not resolved. You need to solve this before you place implants. The patients didn't want this surgery for sinusitis, and that's really not an applicable case. In 2008, without bone graft within the right sinus, 2 implants were placed, and on the left side, without bone graft, implants were placed. 9 years and 8 months later, almost 10 years later after surgery. In the case of chronic sinusitis, if you place implant without bone graft, you can use shorter implant. You can see that the prognosis of implant is favorable. Today I've talked about acute and chronic sinusitis. As for sinusitis, you cannot really make accurate diagnosis with just a panoramic X-ray. You need to use cone beam CT to make accurate diagnosis. Also, you need to prescribe befitting that patient's situation. You need to look at panoramic image and cone beam CT to accurately assess the sinusitis inflammation and then proceed to come up with surgical plans, including bone graft. By doing so, you'll be able to perform implant surgery in a successful manner. Today, I've talked about sinusitis. In the next lecture, I'm going to talk about other diseases related to sinus. Thank you for watching.